Hi, my name is Nur Diyanah and I am from Group 5. Our group will be doing about the period tracker program. The Women's Period Tracker is a digital tool that enables users to record and monitor various aspects like prediction on the next period, prediction on the fertile window, prediction on ovulation, prediction on pregnancy. Users also can note the symptom experience and also a little pregnancy advice. By providing accurate prediction and personalized insight, this application empowers women to understand and manage their reproductive health more effectively. So in this video, we will demonstrate how coding principles and techniques can be applied to develop a functional and user-friendly women period tracker. So let's go! So let's start for the first part of our program. We will collect information about the user like name, age, and the BMI. This part will use the input function to get a variety of answers from the user. For the calculating of the BMI, the elif function is a multi-way decision that is used to classify the body as either underweight, normal, overweight, or obese. So from this, we know a little background of the user that use our program. So we will continue for the next part to the Wan Nur Syafika.
For the second part, we need to get the user to enter the first day of their last period and their menstrual cycle length in days. It then calculates the dates for the menstrual phase, ovulation dates, fertile window phase, and expected date for their next period based on the given input. For the ovulation date, it can be calculated by summing up the first day of their last period with their cycle length and subtract it with 14 days. For the fertile window phase, first day of the fertile window can be calculated by subtracting the ovulation date by 5 days, and the last date of the fertile window phase is by summing up the ovulation date by 4 days. For the expected date of the next period, use the duration of their cycle, which is the cycle length, and sum it out with their first day of their last period. In the context of the code provided in the second part, DEF is used to define several functions that perform specific calculations related to menstrual phases. This function encapsulates the logic for calculating the menstrual phases, ovulation date, fertile window phases, period date, and the next period date. By defining this function, we can reuse the code whenever we need to perform this calculation without duplicating the code.
Hi, my name is Aiesya Salsabila and I will be presenting the third part of this program. In this third part, it will analyze the pregnancy of the user, whether the user is pregnant or not, and it will also analyze the normality of the heart rate of the user. So, firstly, the user is asked to choose the symptoms they are experiencing from a list of possible symptoms. By keying in the associated symptom numbers, they can select various symptoms. They can also choose more than one symptom, and once they are done selecting, they need to kick in done, and then the code will continue to analyze pregnancy using the chosen symptoms, information about the past period, and also the duration of the menstrual cycle. Next, we will also define the function of the is heart rate normal using the pregnant and also the heart rate. So, if the user is pregnant, the normality heart rate is between 70 to 100, and also if the user is not pregnant, the normality of the heart rate is between 60 and also 100. The user is then asked to enter their heart rate, and the code uses the is heart rate normal function to determine if the heart rate is within the normal range. In the program, it analyzes the heart rate for both pregnant women and also not pregnant women. It urges the user to see a doctor if their heart rate is abnormal, and the code then uses the symptom analysis to identify the user's pregnancy status and prints the relevant message indicating whether or not the user may be pregnant.
Hello, my name is Megat Ayman. So in this part, we are calling up a function, the track period cycle function, that focuses on the evaluation of the user's blood oxygen level if the user is defined as pregnant. So we gather the user inputs like the age, the pregnancy, and the cycle days of the period. So if the user enters yes, which indicate that the user is pregnant, so we're going to check their blood oxygen level by listing out the symptoms of having a low blood oxygen level. Some of them are like the shortness of breath, dizziness, rapid heart rate, bluish color in skin, fingernails and lips, chest pain, fatigue, confusion or changes in mental alertness, or none. So then we write out the code. While true, if the user enter 8 or none, then the program will indicate that the blood oxygen level is normal. However, if the user enters more than 3 symptoms, the program will indicate that the user is at risk of having a low blood oxygen level. But if the user enter less than 3 symptoms, the user might have the symptoms, but their blood oxygen level might still be normal. So then, if the user is not pregnant, then we will proceed with checking on the menstrual cycle, whether it is normal or irregular menstrual cycle, by taking out the standard of a normal menstrual cycle between 21 and 35 days. So we basically focuses on if the user is pregnant, we check on their blood oxygen level. If the user is not pregnant, we check on their menstrual cycle, whether it is normal or irregular.
I am Balqis Arifah, and this is part 5, the pregnancy advice. So we will set up a function to get their input, then ask for the gestational age, the pre-pregnancy weight, and the current weight. And based on that, we will calculate. Next is the blood glucose checker. We will ask first for the family history with diabetes mellitus. If yes, then they have a higher risk. If no, then they have a lower risk for gestational diabetes. Next, we will compare if their weight gain is greater than the gestational age. So if it is greater, then they may have gestational diabetes, but if it is equal or less, then it seems that they do not have gestational diabetes. So we will ask for the blood glucose and when was the last test is they ate. And we will compare that and then remark if they have insulin intolerance. Next, folic acid checker. So these are the symptoms for low folic acid and folate deficiency anemia. If they have lots of symptoms for the first picture, then they may have early stages of low folic acid. And if they have lots of symptoms for the second picture, then they may experience from folate deficiency anemia. Last part, vitamin E checker. Firstly, we will ask for the blood pressure in the form of systolic, diastolic, and then next, we will compare the weight gain to gestational age divided by 2. So if the weight gain is smaller than the gestational age divided by 2, which is in weeks, we will say that they have fetal growth restriction, which also indicates that they have low vitamin E. But if it is greater or equal, then they do not have fetal growth restriction. And then next, we will ask for pre-eclampsia symptoms. If they have lots of symptoms, then they may have preeclampsia. If they have zero symptoms, then they do not have preeclampsia. And lastly, we will based on their blood pressure, we will say that they have a higher risk of preeclampsia. And if they do not have high blood pressure, then they have lower risk for preeclampsia.
This period tracker and pregnancy health analyzer Python program provides a variety of features for monitoring menstrual cycles, including menstrual phase, ovulation date, fertilized window phase, and determine that if the user have irregular menstrual cycle. Besides, this program proved to analyze pregnancies from the data and symptoms put by the user. Other than that, this program can evaluate heart rates and determine the level of blood oxygen level, folic acid, and vitamin E in pregnant women. It gives women an easy-to-use, comprehensive tool for keeping track of their health and making decisions. That's all from us. Thank you.